I started with HIV care in 1987 at Cook County Hospital, this woman whose name was Ida Greathouse knocked on my general medicine door, I'm an internist, and said, what are you doing? How come you're not taking care of women with HIV? We have all these issues, and the clinic down there that only takes care of men is not meeting our needs. She was a very insistent, strong, totally wonderful person who you sort of couldn't say no at all to. At that point, if you go to the next one, again and again, women made up like 8% of the reported cases of AIDS in the country. Now it's closer to 25%. We started a single-site program, provided comprehensive medical, including obstetrics and gynae care, and psychosocial care. We included women and children because women came for their kids, but this way they would come for themselves as well if the kids were there. We included drug treatment and mental health services and attention to domestic violence and legal counseling. We tried to address the multiple vulnerabilities by dealing with very flexible programming in terms of appointments, case management, support groups, peer education programs, to sort of create an ambience of caring. And this was at a time when we had no therapy. So really was to try to engage people to stay in care and do a lot of hand-holding. And we learned an enormous amount from the strength of the women that went through the epidemic at that time. What I'd like to do next is share with you what I've learned in caring for women since then, and in a lot of research we've done through the WISE, the Women Interagency HIV Study. Next slide, please. So, just to start with young women and adolescents, who were just minimally addressed, I think, this morning, I think the data's in that there's increased susceptibility for transmission, both biologically, in terms of age-discrepant sexual partners, coercive sex, transactional sex, poverty, and racism. Very difficult time for young women who are at risk. There's poor antiretroviral therapy adherence among adolescents, requiring an enormous amount of multidisciplinary staff and programming to get through. A lot of psychosocial, gynae, and medical problems. I think it's pretty obvious that you need a full medical and psychosocial care program, which would include sexual and reproductive counseling, as well as contraceptive and obstetric services to meet the needs of young people.